on achieving carbon neutral care.
Robert, hi and welcome.
Hi, Marcia. Thanks.
Thank you so much for being here. We were just chatting backstage about Philips, a company that's been around for more than 120 years. And one of the things as global head of sustainability that you are so focused on is how to make sure that you're not just doing well, but doing good, and especially as relates to sustainability. And so let's start this conversation by getting right to the heart of the matter. How do you decarbonize the healthcare industry? And what are the biggest challenges that you face in order to get to carbon neutrality?
Well, thanks for the great question having me, Maisha. Just to put things in perspective, I think previous speakers have already very eloquently spoken about the huge impact of climate change on the healthcare systems. But let's also face the other side, right? The healthcare systems are emitting more CO2 than all airlines together on the globe. And that in a context where half of mankind does not even have access to healthcare. That's 4 billion people. At the same time, more than 10% of the global resource use goes into healthcare, with huge amounts of waste, 30 pounds or 13 kilograms per bed per day in an average hospital, can be worse. So that are just the environmental challenges of the healthcare systems today. On the social side, we see staff shortage, rising costs, burnouts, and so forth. So I think healthcare systems are under enormous pressure, and we need to understand this if we want to talk about decarbonizing healthcare. Now, maybe from the Philips side, I say sometimes jokingly, you don't need a sustainability strategy. You need a sustainable strategy. You need to make sure that you understand where the world is going and how you can contribute to that with your company. And that is exactly the nexus of doing well by doing good, aligning the company targets and strategies with the social and environmental challenges that are out there and trying to make a meaningful contribution. We have been starting in our own time on our own house also on the carbon journey, with decarbonizing our own operations over a course of a decade. I think started around 2010 or so, very systematically with carbon cost curves and what have you not. Since 2020, we operate globally carbon neutral with 100% renewable electricity. And so forth. That gave us a lot of credibility with our suppliers also. If you think about, I'm sure that a lot has been spoken today about Scope 3 emissions also. A lot of our emissions are in the supply chain and downstream. So some of that is, I think, an order of magnitude bigger than the emissions from our own operations. And so a couple of years back, we said to our global supply chain guys, we want you to also sign up to science-based targets. We have commitments for Scope 1, 2, and 3. And we are willing to share our insights, our learnings, and really help you build these capabilities. And we want to have 50% of our 15,000 material suppliers by 2025 on science-based targets.
Yeah, and just to pick up on a couple of things you said, and I want to underscore for the audience, and I appreciate you being so frank about it, which is that the healthcare industry and the healthcare sector globally is a major polluter and an emitter. In fact, research in fact, that including my division at Foreign Policy, FP Analytics, which is the independent research division, has done, that demonstrates if it were a country, it would be the 5th largest polluter in terms of carbon emissions worldwide, which is astonishing when you think about it. And the other point that you made that's so important is specifically as relates to supply chains. It's not just about what the front care, healthcare, providers are doing or hospitals, but the entire supply chain has to be reformed. But to pick up on the last thing that you were saying, so what are those lessons learned? What are the things that you found that can be done sustainably, that can be scaled up and need to be scaled up in order for there to be industry-wide change?
Yeah, if you take the Philips perspective, then I would say it's really about understanding your carbon economics. So it's not just about making big pledges, right? A vision without the ability to execute is just an hallucination. So it's really understanding the carbon economics, putting the investments behind it. It's not just the CSO that needs to know and support this kind of stuff. It's the CFO and the CEO basically who need to get their heads around it. That's one thing. Then, of course, being systematic about this. As I said, we are really teaching our suppliers also on how to engage on these topics. We are creating financial incentives. We encourage transparency with the Carbon Disclosure Project or science-based targets. And the good thing is it seems to be working. So 47% of our supply chain have committed to science-based targets by now, which means we have one of the lowest carbon supply chains in the entire industry, and we are producing in a carbon-free environment. So that's super interesting when you go to care providers and leading hospitals around the world and say, guys, do you want to engage? How can we help you to provide better care to more people with a lower footprint? But maybe that's the next topic.
Well, it's interesting that you say that, and there was another comment that you made that really struck me, which is, from your perspective, it's not that you need a sustainability strategy, it's that you need a sustainable strategy. Now, the counterpoint to that, or a skeptic might say, well, how exactly am I supposed to balance the need for innovation with decarbonization and equity and access? And so how would you respond to that?
I would say it's a wonderful question, and I think the key word is already in there. It's innovation. Because I think innovation is the bridge that you need between providing better care to more people with a lower footprint, right? So some people speak about decoupling, others are cynical about it, but I think we live in an age where we see massive adoption of digital technology in the healthcare sector. So digitalization of healthcare is a real opportunity to make healthcare accessible and dematerialize it. To just give you one tiny example. We have been working on miniaturizing ultrasound devices. So now we have a Philips ultrasound device that has the entire technology basically in the probe in your hand. You just plug it in your phone as a screen. So if you have a 4G connection, you can use a hospital for a second opinion. We're working with the Gates Foundation to develop AI-based protocols behind that that allow basic care workers with 6 sweeps to identify high-risk pregnancies. Normally you need to train a sonographer for 7 years. So it's dematerialized, super energy efficient, much less material, and it makes healthcare really, really accessible.
Literally reducing the distance. I think that's a great example, and thank you for bringing that up. The other thing that you said that just now that's really interesting is that when we think about what is it going to take to actually have industry-wide transformation, healthcare companies and health tech companies can't do it alone. And you mentioned in particular the Gates Foundation, but there are plenty of other stakeholders involved. And so my question for you is this, which is, how are you all at Philips thinking about global policy agendas, whether it's the SDGs, whether it's COP, whether it's the WHO's work on climate? How are you trying to align with those global commitments that have been made? And how are you partnering in order to bring others along?
Great question. As I said, no single partner can do this alone. We have been very engaged with the UN Global Compact. I think we signed the SDGs immediately in 2015 when they came out a long time ago already. We do annually these materiality assessments to see what are the big topics for us, and very consistently access to healthcare, decarbonization, and sustainable use of materials. So SDGs 3, 12, and 13 pop up, and they are the core of our innovation agenda, basically, right? The company purpose to improve 2.5 billion people's lives by 2030, and to provide access to healthcare to 400 million people in underserved communities. So you see it's very deeply interwoven and aligned with the SDGs, and that these frameworks provide a common language and reference points, which makes it easier to identify partners, to agree on targets, to measure these targets.
Measure impact, yeah.
Exactly, communicate about these. And I also really want to use the opportunity to congratulate the WHO on their member states also on the climate resilience framework that they've adopted at the WHA in May of this year, and the great work from Attach at the WHO.
Where we were,
exactly, and Dr. Vanessa Carey to really drive this agenda. So
yeah, and Dr. Tedros was referencing that a little bit earlier, and now the baton needs to be carried forward, right? Because it took 28 COPs before there was any focus on health, but we can't lose that momentum. Well, Robert, it's a real pleasure to have you here with us, and I appreciate you taking the time and sharing a little bit about what you're trying to do. And I know there's no such thing as going solo, so to speak, and so I hope you can bring others along as you continue that work. Thanks so much for being here.
Thanks so much for having me.
Please welcome Josh Carliner, Director of Global Partnerships at Healthcare with